Hello everyone, I am Dr. Swati Kanodia. I am a pediatric and adolescent endocrine and diabetes specialist. In simple terms, मैं बच्चों की hormones की डॉक्टर हूँ जो बच्चों की hormonal issues like height, weight, obesity, diabetes, thyroid, puberty आदि के लिए बच्चों का इलाज करती हूँ. So what is normal growth? पहले normal growth की बात करते हैं. Normal growth means growth in height, weight and head circumference according to the age and sex of the child. So in first 2 years of life, rapid growth happens and that is mostly nutrition related. So it is very important that healthy eating habits are inculcated in the baby. Breastfeeding is most important in the first year of life and limited screen time. Now from 3 to 10 years of age, child grows up to 5 to 6 centimeters a year. And this growth is both nutrition and hormone related. Now, it is very important that the child is given a healthy, balanced diet, has a regular physical activity with limited screen time and minimal junk. Now, from 11 to 16 years of age, that is when puberty happens. So, the child has a rapid growth again and reaches the final adult height. And it is very important that the child has a healthy balanced life during this period because अगर आपका बच्चा ज़्यादा वजन गेन करेगा तो उसकी हाइट अच्छी नहीं होगी and once the bones are fused the child will stop growing. लोग पूछते हैं कि कैसे पता चलेगा कि हमारा बच्चा ठीक बढ़ रहा है कि नहीं या हमारे बच्चे को कोई ग्रोथ का इशू है. So it is very simple, we can know it in various ways. सबसे कॉमन और सबसे पुराना जो आपके माँ बाप भी करते होंगे कि दीवार के साथ बच्चे को खड़ा करके और उसकी हाइट मार्क करना. By this method, you might come to know that the child is growing or not, but whether the child is growing adequately or not is little difficult to say with this method. Another one is, अगर आपका बच्चा सेम कपड़ों में या जूतों में 2 साल तक फिट आ रहा है, तो उसकी ग्रोथ अच्छी नहीं हो रही है. Most of the growth disorders are missed due to wrong guidance or lack of awareness. ज़्यादातर लोग क्या कहते हैं, अरे अभी तो बच्चा छोटा है, अभी तो 18 साल तक उम्र बढ़ेगी और हाइट बढ़ेगी, बढ़ जाएगा. And that is when you lose time and by the time you come to us, the bones would have fused and it is too late for us to do anything. That is why early detection and timely intervention is most important for timely treatment and attaining a good final adult height. So, अगर आपको लगता है कि आपका बच्चा ठीक से नहीं बढ़ रहा, तो अब क्या करना है? So your first point of contact is your pediatrician. Please visit your pediatrician, ask them to take the child's height and weight and plot it on the growth chart, and then they can see whether the child is growing normally according to his or her age, sex and according to the family. Because if the family is short, then the child might be short but growing well. If they feel that the child is not growing well, they would examine the child to see if there are any signs of diseases and they might do certain investigations in terms of doing certain blood tests or x-rays to see if there are any deficiencies in the child and can be treated accordingly. Then they would timely refer you to a specialist called as Paediatric Endocrinologist. ज़्यादातर पेरेंट्स पूछते हैं कि हम अपने बच्चे के दूध में कौन सा पाउडर मिला सकते हैं जिससे उसकी हाइट बढ़ जाए या उसको कौन सा सप्लीमेंट दे सकते हैं जिससे उसकी बहुत अच्छी हाइट निकल आए. So there are a lot of powders, milk adding powders, which are available in the market these days. But these contain lot of sugar and they do not have any added benefit apart from making your child overweight. So if your child does not have any deficiency and is growing adequately, so for the child to have good final adult height, what is most important is 5 helpings of fruits and vegetables every day, less than 2 hours of screen time, 1 hour of daily physical activity and 0 junk. So I hope these questions have been helpful for you and you would take care of your child's growth, and if you feel the child is not growing well, you would take your child to the pediatrician on time. Thank you.